calling the Thursday Committee on Human Services hearing, 3 p.m. calendar. This meeting, including the audio and video of remote participants, is being streamed live on YouTube. You will find links to viewing options for all Senate meetings on the live and on-demand video page of the legislators' website. The Zoom meeting and YouTube live streaming event will include the following agenda, which is basically the 3 p.m. February 18th Thursday calendar. In the unlikely event that we have to abruptly end this hearing due to major technical difficulties, the committee will reconvene to discuss any outstanding business on, today is Thursday, on Tuesday, 3 p.m. When is that? Excuse me. It'll be next Tuesday, 3 p.m. I'm trying to get my calendar here. Excuse me. The 23rd, room 225. For all people participating remotely, all testifier audio will be muted and video disabled until shortly before it is your turn to testify. Please turn on your video when testifying. Because we have a number of witnesses, especially for the last director position, please keep your testimony to 2 minutes. Assume that we have read your written testimony and just add to it. Okay, Present with me, we have all members of the Human Services Committee. So with me is Vice Chair Senator Les Ihara. On Zoom, we have Senator Bennett Misalucha, Senator Laura Ocasio, and Senator Kurt Favela. First up, GM 557, submitting for consideration and confirmation to the State Rehabilitation Council Gubernatorial Nominee Catherine Taylor for a term to expire on June 30, 2022. Testifying on behalf of Catherine Taylor, we don't have anybody registered to testify, but we have some great testimony and support from the Department of Human Services Division of Vocational Rehabilitation, and also from the same department, Maureen Bates and Malia Taumdinek, also in support. Catherine Taylor, are you present? Catherine? Catherine Taylor is not present?
This is Maureen Bates from the Division of Vocational Rehabilitation, and the department stands on the testimony provided in support of the nomination and confirmation. Thank you.
Thank you very much. Anybody else wishing to testify on behalf or against Catherine Taylor as the nominee for the State Rehabilitation Council for a term of 1 year? Okay, seeing none, we're going to move on. Okay, next up, Victoria Kennedy, also for the State Rehabilitation Council, Department of Human Services for a term of 2 years. Nobody registering to testify, at least on time, but we have strong support from Department of Human Services, Vocational Rehabilitation Administrator Maureen Bates, who is also present. We also have in support, so Maureen, are you going to stand on your written testimony?
Yes, the department stands on the testimony provided. Thank you.
Thank you so much. Okay, next up, again, there's a Department of Human Services, Division of Vocational Rehabilitation. We also have City and County of Honolulu Parks and Recreation written testimony and strong support for Victoria Kennedy. Hawaii Fido Service Dogs in strong support for Victoria Kennedy. University of Hawaii Manoa, Dr. Brett Opengard in support of Victoria Kennedy. And I believe we have Victoria Kennedy on Zoom. Victoria Kennedy, do you wish to testify in front of your committee?
Unmuted alert.
Yes, I
Unmuted
do.
alert.
Okay, please proceed, Victoria.
Yes, good afternoon and aloha, everyone. Thank you to Senator San Buenaventura and the members of this committee. Thank you for this opportunity to be able to testify for the nomination. And I would like to also thank Governor Ige, and I am humbled by this nomination. I can tell you that I know firsthand what it's like to have a disability. Back in 1978, I was diagnosed with a rare retinal degenerative disease called retinitis pigmentosa, otherwise known as tunnel vision.
Yes.
Are you able to hear me?
Yes, we can hear you. We just need to mute everyone else.
Okay. And at that time, I was told that somewhere down the line, I would be losing my sight. And of course, I was very devastated. And back in 1978, there was little or no resources available. And so later on, I started to really immerse myself into trying to find out what my condition was. And I did become blind in 2000, and I have become a guide dog handler ever since then. Over the last 3 decades, I have immersed myself in volunteerism, trying to help people who were diagnosed newly blind. And I tried to help them by sharing how I coped, letting them know today all the resources that are available, and assuring them that blindness is not the end of the world. And over the years, I have been very fortunate to have been in many leadership roles with various nonprofit organizations. And this was all to do with blindness issues. And although everything was
Rachel Wong has left the meeting alert.
regarding the blind, I am very empathetic with others who are faced with various disabilities, because I know that having a disability changes one's life. And I just want to thank you again for this opportunity to give testimony, and I will be humbled and honored and privileged to be able to serve on the committee working on the programs for the State Rehabilitation Council. I know that you're probably received all of my testimony, records of my testimony, my answers to the questions of Senator San Buenaventura, and the testimonies. And however, if you have any questions, I would be more than happy to answer them. Thank you for having me here and being before you to present my testimony. Mahalo.
Okay, thank you very much. Members, any questions of our witnesses available? Okay, seeing none. Thank you so much,
Thank
Victoria
you.
Kennedy. We're going to move on, and we will vote on
Rachel
your
Wong has joined the
nomination
meeting.
after the end. Okay, thank you so much. Okay, next up, we have, excuse me, GM 503, submitting for consideration and confirmation as Director, Department of Human Services, Gubernatorial nominee Catherine Betts for term to expire at noon, December 5, 2022. First up,
Now unmuted alert.
okay, first up, we have Director Betts. We know you're busy during session, so please proceed.
Thank you, Chair. Good afternoon, Chair, Vice Chair, members of the committee. Kathy Betts, Director of the Department of Human Services. I'd just like to briefly share a statement that I've prepared today. I come before you humbled and grateful for this opportunity today. I've provided several written statements to you and this committee over the last month, and I've also discussed individually with you my insights and experience working with the department over the last 10 years as ED of the Commission on the Status of Women, as Deputy Director, and now as Director for the last 5 months. I don't believe I've shared some of my background and the experiences that I've had in my life to compel me to do this work, so I'd like to briefly share just some of my own personal background with you so you have a better grasp at who I am as a person. I was raised in a large multicultural immigrant family who immigrated to this country right before the Civil Rights Movement. So I was really born into a family who witnessed a historical era in our country's trajectory towards greater justice. And doing the right thing and working hard was instilled in me from a very young age. In hindsight, I also look back at some of my early friendships and realize that some of my closest friends experienced violence and abuse in their homes, which had an impact on my work working with victims and survivors of violence. From an early age, I've witnessed how many people have been mistreated by systems that purport to protect them, and it drives me to do the work that I do. I believe that the work that we do as a department has a direct impact and can extend a lifeline to many of our residents. Working for DHS, especially during the pandemic, I've seen staff members who go above and beyond and choose to do the right thing every day, even when no one notices. Especially during this pandemic, our staff have worked relentlessly, knowing that if they don't act quickly, a child may not eat or a parent might lose their job because they don't have access to childcare. I've seen great heart in the people we serve and the staff that I work with. When I see the charts exponentially rise in the number of benefits and services we are extending, I don't think of numbers and I don't see numbers. Each number on those charts is a person with an inherent right to be treated with dignity. This work is important to so many families across the state, and even more so during a global pandemic that has knocked many of our residents to their knees. I'm committed to this department and the work that we do, and I humbly ask for your support, and mahalo for this opportunity. Thank you.
Okay, thank you very much, Kathy. Okay, next up, Riker Wada testifying for DHERD in support. Riker?
Aloha Chair, Vice Chair, members of the committee. Riker Wada from the Department of Human Resources Development, and I stand on my testimony in strong support of Director Betts, and we believe she'll continue to do a great job as she has. Thank you very much for the opportunity to testify.
Okay, thank you so much, Mr. Wada. Okay, next up, Linda Takayama, Governor, Chief of Staff for the Office of the Governor, testifying on behalf of the Governor of the State of Hawaii in strong support.
Thank you, Chair. I am testifying on behalf of the Governor in strong support of this nominee. I would also make note that just yesterday, I believe, she was named the recipient of the Rhoda Lewis Award of 2021 by the Hawaii Women's Legal Foundation because of her extraordinary contributions and commitment to public service. I think this is a nominee who really will make us proud of what the department stands for, and I urge your support of her nomination. Thank you.
Okay, thank you very much. Next up, Department of Health in support. Next up, Department of Transportation, Director Jay Butai in support. Okay. Next up, Phyllis Shimabukuro Geyser, Hawaii Department of Agriculture in support.
Mahalo. Good afternoon, Chair, members of the committee. Phyllis Shimabukuro Geyser, Department of Agriculture. I stand on the department's written testimony in very strong support of Catherine Betts. I think she will be outstanding as a director. I've worked with her over the past years, and I'm quite impressed with her compassion and dedication to those that are in need. Thank you very much.
Okay, thank you very much. So next up, Department of Taxation, Director Isaac Choi in support. Isaac, he's not on. I see Kara, Hawaii Status Commission on the Status of Women, Kara Jabola Carlos in support.
Good afternoon, Chair. I'd just like to make a very brief statement in strong support of this GM and Director Betts' nomination. There is a long list of support testimony, and there are so many community recognitions and accolades that Ms. Betts has received, but I think that what speaks loudly to me in terms of her qualifications are some of the hidden moments. And I wanted to share just a quick anecdote of that. When I first met Director Betts, I was a lowly law student who was rarely given the time of day from anybody, and Kathy was so accessible and respectful, and when she didn't have to be. And I think it's just one of dozens and dozens of examples of her character and the way that she carries herself as a principal leader who values community, especially community that might not normally be valued. And I think that's so reflected in the testimony today and our overwhelming support for her. So I would just, again, restate that I am honored to testify in her support today. So thank you so much.
Okay, thank you very much. Next up, Hakeem Wasanas, testifying Hawaii Public Housing Authority in support. I see Hakeem.
Aloha, and thank you, Chair, Vice Chairs, and member of the committee. We stand on our testimony in the strongest possible support, but also gives me a great pleasure to add that not only Kathy is very experienced, but equally as important, working with her, we found her to be a great leader who is intuitive, creative, passionate, honest, with truly unparalleled integrity, very responsible, kind, and cares tremendously for the most vulnerable people that we serve. I can go on and on and on, but I know there's a lot of people also waiting on this, so I'll keep it at this. So we urge you to pass this nomination. She is absolutely great candidate and great human being. Much mahalo.
Okay, thank you very much, Hakeem. Next up, Catherine Awakuni, DCCA in support. I see Catherine.
I'm there, Chair. Thank you, Chair. Members of the committee, I stand on DCC's testimony in strong support of Kathy Betts. I'm very, very grateful to have her on the team, and am confident that she will continue to do an excellent job. Thank you for the opportunity.
Okay, thank you very much, Kathy. Next up, I see Kathleen Algar, Hawaii Children's Action Network in support.
Hi, Chair, Vice Chair, and committee members. I just want to, you have my testimony, I just wanted to mention again how wonderful it's been working with Kathy, especially for our working families and children. Childcare has seen such a hit since the pandemic, and Kathy and her team have been really wonderful in making sure that families have their needs met. So very happy to testify in support of her nomination today. Thank you.
Okay, thank you very much. Next up, I see Hilton Rethel for Healthcare Association of Hawai'i in support. Hilton?
Thank you, Chair, Vice Chair, and members of the committee for the opportunity to support Kathy Betts' nomination as Director of the Department of Human Services. We're very appreciative of Kathy's openness to meeting with us and our members, to listen to our concerns and feedback, and to willingness to take action when it's needed. We look forward to working more with Kathy and her team at DHS, and we encourage your committee's support of her nomination. Thank you.
Okay, thank you very much. Okay, next up, Rachel Wong, One Shared Future in support. Rachel?
Hi, Chair, Vice Chair, members of the committee. As a former director and now as a community resident of Hawaii, I stand in strong support of Kathy Betts as the new director.
Okay, thank you very much. Okay, next up, Karen Tan, Child and Family Service in support. I see Pankaj, former director, now an individual in support. Pankaj, your turn.
Aloha, Chair, Bonaventura, Vice Chair Ihara, members of the committee, Pankaj Vinod. Of course, a lot of aloha and mahalo for all the support you have provided me for over 21 years of my career with Human Services. It's such a moment of great pride, as you all know, that Kathy has joined the Director's Office in 2017, and I had the pleasure of inviting her. Based on her background and commitment to serving Hawaii, I invited her to join the Director's Office. And of course, it's a moment of great pride that she has taken over the mantle and is nominated for the director's job. And I'm absolutely confident, beyond a reasonable doubt, that she is going to be the best director the department has ever had because of her background, because of her passion, because of her empathy and concerns for the vulnerable population of Hawaii. And also, Kathy's educational background and professional experience, which is evident in her resume and in her work and all the awards that she has gotten. Particularly, I would like to focus on her character, integrity, fairness, professionalism, and empathy for those who are struggling to make ends meet, desire to serve and do the right thing for right reasons, commitment to protect health and safety, and promote the well-being and self-sufficiency of Hawaii's families and children, makes her an ideal person to lead DHS during these challenging times. And as you all know, those who have worked with me and over the last 4 years of my directorship, and also during the last year with Kathy as the Deputy Director of Human Services, the department has done an unbelievable job of addressing the needs of Hawaii's vulnerable populations during the pandemic. Kathy was instrumental in creating that plan, in implementing that plan, and also drafting the budget that you have in front of you, and also many of the administration bills that you have in front of you. It clearly shows that she has the passion, commitment, and ability to deliver for human services and for our Aloha State. For those reasons, I strongly urge you to support this nomination and recommend Kathy's appointment to the full Senate. I'm very, very thankful for the opportunity to testify.
Okay, thank you so much.
Chair, Vice Chair, and members.
Okay, thank you, Pankaj. Okay, next up, Keopu, no, is it Keopu? Yeah, Keopu Realits.
Aloha.
Aloha.
Aloha, Chair, Vice Chair, members of the committee. I'm here today in my personal capacity and as a private citizen to strongly support the nomination of Ms. Catherine Betts as Director of the Department of Human Services. I have submitted written testimony, and I'll let that speak for itself, but if I may, I just want to add a little bit more for your consideration. I previously worked for the Department of Human Services in the Director's Office, including while Kathy, as I know her, was named Deputy. During my time in the Director's Office, I gave birth to my 2 sons, and we are your quintessential multiracial working family, and it meant so much to me at the time to have another mom of young children in the office with us. Not only did she know what I was going through, I also finally had an example of leadership that I could see myself in, because it's not often that we get to see brown mothers who are, taking actually caregiving roles at home, help lead state government departments. But honestly, Kathy's position as a mom did and will do more for the department than it has ever done for me. DHS, I know from working there, is all about serving Hawaii's children and families, and so who better to lead a department like that than a mom? Who's going to know the true value of childcare, of healthcare coverage, of protecting our kids? Who better than someone who has a family of her own and a career dedicated to supporting families like hers and, quite frankly, families like mine? I believe Kathy's resume speaks for itself, and I hope my written testimony speaks to how I witnessed Kathy's unquestionable ability to lead this department. I just wanted to be sure that it is known that not only is she well qualified from her education, training, and leadership in law, policy, advocacy, communities, the list is endless. I just want to make sure that if you ever get a chance, you ask her kids, because they'll tell you that she's in the Department of Human Services in good hands. Thank you very much for the opportunity to testify in support of this nomination.
Okay, thank you very much. Next, I see Joseph Campos, the second in support. Joseph.
Good afternoon, Chair, Vice Chair, members of the committee. Joseph Campos, Deputy Director of Department of Human Services, but testifying as a private citizen. I stand on my testimony in strong support of Kathy's nomination. And if I may stress, Kathy's humanity and humility are important aspects of her leadership. She has unsurpassed commitment to serve the people of Hawaii and instills that commitment throughout the DHS staff. Thank you for this opportunity.
Okay, thank you. And next up, Amanda Fernandez in support. I see Amanda.
Aloha, Chair, Vice Chair, members of the committee. Amanda Fernandez, offering strong support for Kathy Betts' nomination for Director of the Department of Human Services. I'm testifying in my individual capacity today. I'll stand on my written testimony and just want to reiterate what so many before me have said. There's no one more suited, more qualified, more compassionate than Kathy for this position. I strongly support her nomination.
Okay, thank you very much. Okay, no one else having registered to testify. Those who have submitted written testimony are Craig Hirai, Department of Budget and Finance and Support, Department of Health and Support, DLNR Director Suzanne Case and Support, Hawaii State Energy Office Scott Glenn and Support, Department of Human Services BESD Benefit Scott Nakasone in Support, Kenneth Hara in Support, Department of Labor and Industrial Relations, I think that's General Hara in support, DLR in support, Department of Accounting General Services, Audrey Hidano in support, Hawaii Public Housing Authority, Barbara Arashiro in support, Workforce Development Council in support, Department of Accounting General Services again in support, Public Safety in support, DBED in support, Mike McCartney, DHS BESD, Brian Donahoe in support, William Isla, Department of Hawaiian Homelands in support, Hawaii State Commission in support, Lauren Yamaguchi, Nancy Creedman, Domestic Violence Action Center in support, Matthew Sasaki in support from HMSA, Hawaii Family Caregiver Coalition, Gary Simon in support, Hina Malka, Alan Johnson in support, Harm, Tracy Ryan, Harm Reduction Hawaii, comments, Elena Kabatu, East Hawaii Region of Hawaii Health System Corporation in support, Eric Abe, Hawaii Primary Care Association in support, Focus, Christy McPherson in support, Planned Parenthood Votes in support, Parents and Children Together in support, Hawaii Women Lawyers, Mihoko Ito in support, Aloha Care in support, YWCA Oahu, Noriko Namiki in support, Child and Family Services in support, and 40 other individuals all in support. Anybody else on Zoom wishing to testify on GM 503? Questions, members?
I have a question, Chair.
Okay, so Senator Misalucha has a question.
Kathy, so you have an incredible support system, and I'd like to just provide you an opportunity to demonstrate your leadership, and particularly in the face of COVID. Can you articulate an instance or several instances wherein you demonstrated your leadership in the face of COVID, particularly taking into account the collaborative style of leadership that you have and what those outcomes might have been?
Sure, thank you, Senator. That's an excellent question. I think that there have been lots of opportunities for us to collaborate with our community stakeholders during this pandemic, and it really expedited the way that we did our business with the community and how we collaborated. One such instance is, we received $15 million in coronavirus relief funds for childcare. We quickly worked with Representative Linda Ichiyama and Governor's Office and BNF to execute a grant program so that childcare providers would be able to reopen safely for children. And we partnered with the Hawaii Community Foundation to execute those grants, which ended up reaching hundreds of childcare providers across the state so they could reopen safely for children. And they were able to expend about $13.9 million in federal funds for those childcare providers. So that was one such instance. We were also tracking multiple sources of federal funds at the same time, whether it be through the first CARES Act or the second CARES Act or the Supplemental Appropriations Act, as well as the CRF funds that came directly through the state, to make sure that they got into the hands of the most needy residents. We also collaborated with the Department of Education to issue our PEBT financial supplements. And we also worked immediately to ensure that PPE was provided and procured for our statewide offices as well as our providers. across the state. So a lot of movement on all fronts, but I couldn't do it without this team. But we had to move quickly, and we, especially when the pandemic first hit the continent, we were very cognizant that it would hit us soon. And so we moved very quickly to ensure that we had things in place, that we had telework provisions in place, that we had PPE in place. So those are a couple instances.
Great, thank you. One more question, Chair.
Okay, go ahead, Senator Misalucha.
So, Kathy, I know you started at the Department of Human Services as a deputy director, and then you stepped into the role of director. When you were deputy director, I'm sure you might have observed things that could be improved, as nothing is perfect. I'm just curious whether at the point when you became director, were there any changes that you made, any initiatives that you instituted, or a policy change perhaps from the prior administration?
That's also a good question, Senator. Actually, we've been continuing with our core values and our mission and objective within the Department of Human Services. I helped to collaborate with former Director Benoit, who we saw earlier on the Zoom testifying. I worked very closely with him, and unlike other departments, there is only one deputy, so I was really his sidekick in everything that we did, and we collaborated on everything together, including the vision for the department. And so I'm definitely extending that legacy into the current workforce. Some things that are top of mind for me to work on are staff morale. As I mentioned in my opening statement, our staff has been working tirelessly and relentlessly for the last year, and that's outside of their other responsibilities, whether it be caring for a parent or a child or potentially being ill themselves. I mentioned in one of my written statements, one of our units unfortunately and very tragically lost, I believe, 4 individuals in one small unit in 1 year. And so bolstering their morale, keeping them safe, and ensuring that they are committed to the work is top of mind for me. And that's what I hope to accomplish during my tenure.
Thank you, Kathy. Thank you, Chair. I yield to the other members.
Okay, any other questions? Members, I just have one more question for Kathy. So Kathy, you took over from former Director Benoit in the middle of a pandemic crisis. And so, and I understand Senator Misalucha's concerns that, when there are weaknesses, you could step in. But frankly, you are stepping into big shoes, because compared to Department of Labor, where we have multiple complaints, despite the huge increase in the number of SNAP applications and MedQuest applications, I have had zero complaints about how Department of Human Services handled the huge influx of SNAP and MedQuest benefits. So to that extent, I hope you continue to follow through with Director Benoit and make the changes that's needed later on after the pandemic. Okay, I mean, can we at least agree to continue the huge IT progress you guys did?
Absolutely, Chair. I think that the magnitude of this pandemic has been quite huge. I'm concerned about the long-term impacts. Obviously, you've seen our increased numbers exponentially across the board, and we don't foresee this to change in the near future. So we'll keep on working at this pace. I cannot underscore the importance of shoring up our social safety net for our residents. So we'll continue to do that and advocate for that. Thank you.
And I do want to thank you for not dropping the ball when Director Benoit resigned in the middle of a pandemic, retired in the middle of a pandemic. Okay, I personally was distressed with that. So I'm really happy that you did not drop the ball. Any other questions, senators? Okay, seeing none, we're going to do a short recess on decision making. Recalling the Committee on Human Services, February 18, 3 p.m. calendar for decision-making. Chair's recommendation on GM 557 on the nomination of Catherine Taylor for the State Rehabilitation Council is to advise and consent. Vice Chair for the vote.
Okay, Human Services Committee members, we are all members are present. We're voting on the chair's recommendation to advise and consent to GM Governor's GM 557. I'll go through the vote. Chair San Buenaventura.
Aye.
Vice Chair votes aye. Senator Ocasio.
Aye.
Senator Misa Lucha.
Aye.
Senator Favela.
Aye.
The recommendation is adopted.
Okay, thank you very much. Next up, GM 558, Victoria Kennedy for the consideration confirmation for State Rehabilitation Council. Chair's recommendation is to advise and consent. Any Vice Chair for the vote?
Okay, not hearing any discussion. The voting on the chair's recommendation to advise and consent to GM 558. Any reservations or objections to the chair's recommendation? The recommendation is adopted.
Okay, thank you very much. For GM 503, for the Director of Department of Human Services, Gubernatorial Nominee Catherine Betts, again, chair's recommendation is to advise and consent. Any discussion? Seeing none, Vice Chair for the vote.
Any reservations or objections to the chair's recommendation to advise and consent to GM 503? Hearing none, the recommendation is adopted.
Okay, thank you very much and congratulations.
Thank you.
Okay, we're adjourned. Now goes for a floor vote.